Health Talk, brought to you by Rapides Regional Medical Center.
Aortic stenosis is a narrowing of the aortic heart valve that controls the blood flow from the heart to the rest of the body. It's estimated that more than 2.5 million Americans over the age of 75 have aortic stenosis.
Once it gets to severe is when you start seeing symptoms. And most often those include chest pain, shortness of breath, dizziness, palpitations. And if untreated, a lot of times it can progress to heart failure, stroke, or even death.
Central Louisiana residents suffering from aortic stenosis can now have TAVR performed at Rapides Regional Medical Center without having to leave the area.
Transcatheter aortic valve replacement. So the procedure is basically we put a catheter that goes through your groin or sometimes through your arm, and we can deliver the valve to replace the old valve. There's not just one doctor involved, there's several doctors. That includes the two surgeons that we have, Dr. Granger and Dr. DeWitt, who have been very helpful in bringing about the heart valve to Rapides. And there's also other departments, and it's honestly a team effort.
According to the American College of Cardiology, about 50,000 patients will have TAVR in 2018, with the number increasing to 100,000 by 2020.
Currently, the procedure is for patients that are intermediate or high risk for surgery. Typical recovery time is about 1 to 2 days, and they usually can go home in about 2 days after the procedure.
For more information, visit rapidesregional.com.